But the symptoms are.
Is it mostly adults or children?
It's adults, almost entirely adults. I don't believe that any of the cases diagnosed in New York are children.
How much is dermal transaction? How much is sexual transaction?
In New York, unlike Africa, which is just family and whatever everybody, there are children involved. In New York, it still seems to be confined to men who have sex with men. But I know that there was at least one breakout and I think it was in Suffolk County of a woman who reported no activity of that. So it's going to break through. It's just a matter of time. There it is. Okay, this is the resolution I presented last month when I was calling it a bookkeeper 2. As I indicated last month, we've gotten a lot of money thrown at us by the state because of COVID, and we're managing a lot of grants, and the complexities of the bookkeeper position have increased. And I need some redundancy when it comes to my fiscal officer. He wins the lottery, I'm really going to be in a lot of trouble because somebody else needs to learn his job. And because of that, plus the complexities of the tasks that are coming, we were looking at a bookkeeper 2 position. Civil Service has approved this position under the title Public Health Fiscal Technician. So this is a slight bump up in salary, but it gives me an opportunity to train a bookkeeper to learn more about the programs and be the backstop for 10.
I'll move it.
And second.
Further discussion? All in favor? Aye. Opposed? Carried.
So across the state, what a lot of the health departments are doing now that we've sort of hit the lull, and when it comes to COVID, and we know we'll be giving shots to the kids in the fall. We'll be giving boosters to adults under 50, but that's very manageable. I think we're in some respects we're sort of past the worst of the pandemic if it stays on the track it seems to be on. A lot of us are doing staff days where we get to sit down together and say, okay, what did we do good? What did we do not so good? What do we want to change for the future? This individual, Jane Fisher, is out of Buffalo, University of Buffalo. She's somebody that a number of health departments have used to do these staff days. And I would like to hire her to do this. She is pretty unique in terms of how she presents this. This is August 24th we're looking at as a date.
Do I have a motion?
How much is she?
$32.50. $3,000.
I'll move it.
Second.
Further discussion? All in favor? Aye. Opposed? Carried.
So we've reported out that we've had a few failures, electric failures, and the generator fails to kick on. They're going to try to figure out why it won't kick on, or why is it kick on and then kick back off again. This last failure we lost polio vaccine. It was the only one we lost, which was good. So we in need of a new system. Ray Czerkowski, the county engineer, helped us and went out and what we're looking for 2 things. We're looking for a battery backup system rather than using the generator, so the batteries would just be there and just keep the refrigerator and freezers going. And we're also looking, which is the next resolution, looking for a dialer that will contact us immediately, or Sheriff's Department, which is what it is now, immediately, so that we know that the power has been out. But the new dialer system would also give us the benefit we don't have now of being able to go into a computer and see what happened. So right now, I'm getting ahead of myself on the second resolution, but if the Sheriff's Department calls me and says that your power is out and we just got a call from your refrigeration unit, somebody has to physically go to the department and check and see what happened. It could be a blip. It could be just the power went off and it came right back on. But because it trips the thing to the Sheriff's Department, we have to go in. So this is a combo thing. This is $11,210 with the battery backup system. This is the first resolution. I'll stop talking.
Do I have a motion?
Yes.
Second.
Discussion? I have an item, and we might need this if we ever get the monkeypox vaccination, if they don't send it to those gambling on the ponies.
Well, we have gotten a phone call. We actually got a survey from the state health department if we're willing to take the vaccine. The good news is it doesn't have to be stored in like a super deep freeze or anything else like that. So we said, yes, we would take it. I should also note that both of these systems can be easily paid for through the COVID money that we've been getting.
Terrific. All in favor?
Aye.
Aye. Opposed? Carried.
All right, so this is general control. This is the lowest bidder of the dialer system that we would be able to be notified and then dial in on. It's 4640.
I'll move it.
Second.
Further discussion? All in favor? Aye. Opposed? Carried.
Okay, and here's the director's report for the month. I don't know if you have any questions.
How are the COVID numbers? Are they sinking,
They-
consistent, or they
They
rising?
dropped very slightly and then they leveled off. So I think this past week we had 90 positives. Then we had, I think the week before we had 87, but the week before that we had 110. So they dropped a little bit, but they've leveled off. And my guess, they're not bad this week. We had the lowest Monday that we've had in months, 24 cases. And I think we had 7 this morning. So I would love to see that trend.
Has there been any more support that B5 is more virulent than the others, its predecessor?
We just continue to hear that it is, and that's why I got the mask on. This room is terrible. This is a breeding ground and a half for the virus because we're all sitting close to somebody who is.
It's an indictment against me as a chairman. I'm not kidding. I should require masks for everyone. And I will for the next time.
I just like I say, I don't wear a mask when I go to Walmart because my contact with somebody walking by in the hallway is just very limited. I don't wear a mask when I go to the gym, even though I do cardio, and because the system there is the best you can get. It's a Merck 13 and it brings everything out. But this room is just tough. This room is just too close. And
So it's real.
well, I wore one to the department head meeting this morning because I knew that we were all going to sit there and be, close across the tables from each other and everything else like that. And I wore one there, but I do wear it in certain cases where I know I'm going to be in close proximity.
It's the proximity of us.
It's the proximity.
Yeah, if we were all sitting around this table,
Well, nota bene for the next meeting, if we're in the same room, I'd like to have one to wear a mask.
Okay.
Although I've been snickered at with my whiskers wearing a mask. People say, what are you going to do with that?
Make sure you respect the person.
It could be worse though if you had one of those beards down in here.
I used to.
Then it would look even sillier. But,
All right, any further questions for Mr. Matt? I just have one last question. I know it's a bit of a digression, but going back to monkeypox, sexual transmission, someone said that it's more prevalent now because there's less prophylactic use, because there's stronger protection against the spread of AIDS through some antiviral oral medication. Is that true?
Well, I think that, from what I've heard is that there's a feeling among folks there's a frustration among folks who are working on the AIDS thing is that the younger generations just haven't been through what we've been through when it comes to AIDS. We understand the magnitude of it, and they just don't necessarily take it as seriously as, and after all, there's meds for it, kind of thing. And so, yeah, I think that's, but I think with monkeypox, I'm seeing it there down in New York City. New York is getting a paltry, 30,000 doses of the vaccine, and there are people lined up, for blocks to try to get in and get it down in the city. So I think there are people taking it seriously and want that vaccine, but they can only make it as fast as they can.
What's the local education around it?
There really isn't any right now. There really isn't any. I think we need it. I think we just recently, either Monday or Friday, got some education material from State Health Department
Okay.
that we're going to put out. We got some PSAs that we can use or whatever. We're going to start using it.
Planned Parenthood campaign.
Yes, I agree with that.
Yeah, and the cases double in a single week, right? Last.
Oh yeah, it's going crazy. Okay.
Thank you, sir. Okay, next up, Office of the Aging, Mr. Kevin McDonald. Howdy. How are you?
I'm fine. How are you, sir?
Excellent, thank you.
My first resolution is seeking authorization to fill a vacant site manager position, which is open due to retirement. Was at the point one committee and went through that.
Do I have a motion?
Yes.
Second.
Discussion? All in favor? Aye. Opposed? Carried.
I have a quick question.
Sure.
Is this, when it is site manager, is it somebody that can go anywhere? Or is it one specific?
They can go anywhere. We have made it specific basically, but they can move around. Matter of fact, the person that we hired to do our per diem is being moved around right now. She was down in Copake yesterday, and I think she was in, or no, Copake today, and she was down in Malaysia, and she'll be in Hudson next week. So,
Gotcha.
and that's where we're hoping to keep her, in the Hudson site. Okay, second resolution is to contract with the Stuyvesant Falls VFW to utilize their grounds for our annual Senior Day event, which is on September 8th. We haven't had it in 2 years because of COVID. We're hoping that, we'll be able to have it this year, as long as the numbers stay okay. It's an outside event. We've got 20 vendors lined up.
Yeah, about that.
About 20 vendors, and it's a fun day. Everybody has a good time. It's like a picnic for all the seniors.
Yeah.
Do you have advertising for that we could share with our municipalities?
Yeah, we've already put it out in our newsletter. We've announced it, and like I said, once we get approval for it, we'll be,
Well, then I'll delay no further. Do I have a motion?
Yes.
Do I have a second?
Second.
Discussion? All in favor? Aye. Opposed? Carried.
okay, moving on,
It's not done now.
getting that out. Okay, my last resolution is seeking authorization to accept a $200,000 grant from New York State Office for the Aging. It's to be used for the Everhome Columbia pilot program. And I do have some questions about this. Like I said, when this was originally presented several months ago, at least I think most of the board was under the impression that the $200,000 was to be used for additional expenses that would arise in our department because of this program. When we just got the grant award, the notification of the grant award, and the state has included other things on there that the money could be used for, but I didn't really want to go down that path yet until I got, some kind of guidance from the board as to, what we can use the money for. If you look on the grant award on the back, it's got some of the ways that some of the money can be spent. Again, we were under the impression originally when this came out that it was to provide services offered under our programs that are related, to the clients and referrals from Everhome. That hasn't happened yet because I believe you'll see when we go over my monthly report, they've only got 6 cases right now in Columbia County.
And they were shooting for 200
300, 400.
to start with?
Yeah, it was
By
up there.
September.
And why would that be?
Why they only have 6?
Yes.
Lack of marketing.
Yeah, marketing. It's
So it falls on them, not us.
no, it's not on us. I mean, like I said, when
I know.
we were authorized to participate in this project, that's what we're doing, participating in it. And like I said, we've provided referrals to them, some of the cases that we thought might benefit, and I believe 3 of the cases are ours that they've got.
There's 2 now that are ours.
So
And they provide personal care aides.
We're providing rescue
Virtually.
care to 2 of those people, 2 of those cases.
Are they getting paid by a case or are they getting paid flat fee or how are they receiving?
There's a registration fee for each individual. There's a
Right.
subscription.
Do they have staff?
Yes, yes.
Right, I mean, they have, yes, they have staff, like they have, 2 social workers who are care managers. There's another person who I think might be their marketing person as well. But, and then they have their, tech people.
I know the top heavy.
Right.
I'm
right.
talking, I know that I've already met all the top heavy,
Okay. Well, they don't have staff to deliver the services. That would have been, you know,
like the respite care.
right, that would be to contract then, or to make people aware of services in the community. And we have 2 of those clients who are receiving respite services.
Okay.
But, you know, we've made suggestions like reach out to all the senior clubs. They have reached out to the hospital. We've suggested reaching out to the rehab facilities in the county. And also recently, you know, suggested radio advertisements, because what's happened is there's been a few.
How does that call that you're gonna need these other support systems like transportation and meals? So obviously,
Like right now, it doesn't look like we're gonna need it because they only have 6 cases. But I mean, if they end up getting even half of what they projected, okay, and if those half require Meals on Wheels, if they require transportation to the grocery store, if they require, you know, aid service in the house, that's all that's gonna be coming out of us. And rather than the county footing the bill for these extra, we wanted to have that money sitting there to cover that.
But isn't the whole idea designed to keep people at home? I mean, if they get where they want to get, you're going to see the need for long-term care not disappear, but dissipate. So, you know, to say, well, there'll be costs centered around people who stay at home as opposed to going into long-term
Right.
care, it's a whole lot less cost.
Absolutely.
And I don't think the
Yeah.
county itself should
Right.
bear that, but, you know, we're trying to figure out a way to move away from long-term care. So I think there's gonna be some costs to it, and then it is a matter, but I don't think that's part of this conversation.
No, I
No.
read it different. I think the way you did. I don't think there's any requirement to
Right,
spend
I don't
money on
know.
advertising. I think they've expanded the list of options.
Correct.
You can choose those things.
Right.
There's no requirement.
Right, and I think we definitely wanna move towards this, but maybe we wanna, and I can ask them, come back in here and what is the disconnect? Or maybe some professional marketers, okay, marketing people have to help
Right.
with how do you advertise this and how do you get it to the populace that you're better.
And again, I mean, and in my opinion, that doesn't belong in our department.
Agree.
Right, you know, as far as that, that's what my fear was, is that if they give us this money and they want us to use this, we don't know anything about advertising.
Right, I think,
well, why don't we accept the money and we can do that in a resolution? You can generate a structured approach to how you want to distribute it. And we can have someone, if you're on the board, can you bring in someone from
yeah,
Everham
I'm
to
certain
repeat
that
this?
I don't know when it's gonna be convenient, hopefully next month, but I certainly could. And again, I'm one of several advisors, on PJ Keeler's. And
Right.
We all bring a little bit of
Well,
our own expertise.
PJ's the one that brought it to our attention that there was a misconception out there that we wouldn't accept the money. And I said, no, that's not the misconception is that we were under the impression that the money's to be used for one thing, and then now it's being broadened, which I don't have a problem with that, as long as the board doesn't have a problem. I didn't want the board to accept this money under the old pretenses that it was only to be used for our services.
So with,
Program.
I have a kind of question, I might have been asked when I was out, but they're in Albany County, they've been in Greene County, they've been in Columbia County, they got 6 in Columbia County. And their goal in Columbia County was how many?
3 to 4.
Do they have that many at all total with
Well,
Greene County, Albany County,
And
Woodstock County?
Ken has been in contact with Greene County. They are not, as of 2 weeks ago, they weren't doing the program. I don't know if it's on hold, but they're not actively involved in it right now.
Or no, I would say that the answer is no, so there's no way to measure this.
Yeah.
That's the problem. So we have the theory, that this, and again, I laud any idea trying to move away from long-term care, we all do.
And then the other thing I didn't want to do, I didn't want this to create new positions in our department, because as people have said, what happens when this goes away in a year is that, are we, I don't want to say stuck, but then is the county paying for these people? This way, again, if we accept this money, I would like to have the option to contract with Everhome and say, okay, if you think marketing needs to be done, well, then you take the money and you go out and hire a marketer instead of us doing it.
But then again, if you look at that, if we don't accept this money right
No,
now,
right.
it's the death knell probably of the project if the own county won't support it.
Right.
They have a marketer, don't they? They do have a, yeah.
Supervisor Muskin?
Yeah, it seems to me like, before we accept it, we should have a conversation. Because it seems a little, very confusing and downright murky, how this is being handled. I mean, I'm very confused about what is this money for? What are we doing? It's for 6 people. It's like, you know, I like the idea of the program. I just think it's very confusing. So if we accept the money, then you're already in it. Maybe before we accept it, that we iron out what's going on, so we can understand what it is that we're accepting money for.
Well, just to clarify, and Ken is our finance guy. They're not going to actually give us $200,000. That's not the way these grants work, is that as we incur expenses related, then we just voucher for them.
Yeah.
And that, but they don't give us like a $200,000 pot of money to start with, and we spend as it's like as we incur expenses, then we send them up to the state and they'll
You were
reimburse.
suggesting that they do the advertising, for example, so they would incur the expense, not us. There was one proposal you made before that they would I mean, it's very confusing.
It is.
Spending what?
It is, and I wonder if there's a difficulty, and this is something that I'll ask, if it requires some sort of governmental agency or maybe a nonprofit before they can even distribute. I just think it's probably not clear enough. I'm not clear on what they think the goal of this money is. If it's to get the word out, if it's to get a better understanding, if it's to educate the entire public, including the government.
I think the state is basically telling us we could spend it any way we want towards this project.
But what does that mean?
Well, like I said, Dan, that's what they spelled out in the grant, what the money can be used
Kevin,
for.
the clock has started already, right? Like this
April.
started in April and
Right.
goes until September 2023. So do you feel we have time on our side though for Bob to connect this with someone to come and talk to us so that this could be tabled? Or is there an urgency here to make a decision one way or another? Because it sounds like, I agree with Supervisor Mustin, it's murky, and that's being kind. Just from being an audience member here and listening to this whole conversation, nobody has clarity. So I think it behooves us to give ourselves the luxury of a month to say, let's pause, get somebody in here, hopefully, if you think they could come in here in a month, or maybe it's 2 months, then it's a different math, because, we take away just an additional
And you said
month's worth of
Green
time.
County's not participating?
Right.
As of this point,
Do we know why? They decided not to.
When I talked to Green County, their concern was they want to provide services equal to everyone. And they have, I forget, 1,200 people that do not have internet access, which the system requires. And
Yeah, we have a
they have no
broadband
way
issue in our
to
county, too.
implement that either, so
Right.
they were pretty much out. They didn't like the presentations either.
Okay. So Mike, the last question, so the money is in Albany or in New York State somewhere. So the only way we get reimbursed is if we voucher it.
Right.
So if
Right, Ken?
we accept the money, we accept the money today, okay? So on September the 1st of 2023, we could voucher $200,000 or nothing at all.
Right.
So whether we accept it tonight or we don't accept it tonight, if we never used it, it's still there, correct?
Correct.
So that's my thing. So am I making sense? Because you have to get reimbursed by it anyway. So the county foots the bill first. If the county if they say, okay, we're gonna hire a marketer, so then we have to hire the marketer, then voucher the state to get the money from the grant. It's not like you have a $200,000 bank account earmarked for this.
Right.
So I say this, whether we accept it or not tonight, which we could, it's just gonna sit there and then be taken away the day October 1st, 2023.
That's a good idea.
Does that make sense?
Yeah, even though if we accept the grant, doesn't mean we have to use the money.
Correct.
Is that what you're saying?
Correct.
So there's a luxury to get a better understanding of it.
Right.
Yeah, so
Right.
if we accept it, we get the better understanding. Does that make sense?
I think that's right, because until you bill against it, it doesn't
Right.
happen. And as I'm,
That way it's not postponing it another month either.
Correct.
if I could ask these questions, if you don't mind, because I am looking at traditional suggested activities.
Mhm.
So, to me, we're trying to incentivize people to get involved with the program, and this might do that. I'm not sure how that.
Right, right.
Someone
right.
needs to explain to me how that's gonna catch their attention and get a lot of people to sign up for this. So that's sort of my question. I think there's a lot of good intention here. And the intention I see the most is, hey, we really want to try this program and we need to get a lot of people to participate.
Yeah, it'll be nice to hear comments from the state
Right,
office. of
right,
aging
exactly.
representatives.
And how is this going to get a lot more people to sign up for it? I think that's a fair question. I'm gonna ask it as an advisory board member. People in this audience have asked it. Let's get an answer.
Are you opposed to accepting the fine?
I'm not.
No, okay.
I'm not,
Are you
because
done now?
we're not accepting, we're accepting the ability to accept the funds.
Exactly.
Okay.
That's a good point. It's a very good
There you
point.
go.
I agree with
All
that.
right, one more Supervisor Adams, and then we'll move on this.
I was just gonna say, it's the same thing a little differently. We knew this money was coming, so it's not a surprise. We've known since the beginning it was coming. And I think that at this point, when this program is a little fragile, would not be the time to postpone it or to, because there might be the perception that we were somehow withdrawing, we're not fully supporting the program. So I think because there are no strings attached, we should absolutely take the money.
I move it.
I second.
All right, we've had plenty of discussion, but I'll throw out further discussion as standard operating procedure, and all in favor? Aye. Opposed? Carried. Thank you for everyone for participating. That was very nice.
And I have my committee report, if anybody has any questions about it. Oh, the only other thing I was gonna say, is there any way that I could do like a quarterly report instead of a month-to-month report? What happens is we've got various programs and some of the reporting requirements for the state do not coincide with our monthly meeting. I was just wondering if we could do like a 3-month report. That way, I think we give you more accurate figures. I guess you'll notice on one of them, as far as our legal services wasn't available because they don't report that information until after this meeting, so.
I think I had made that suggestion before.
I think, yeah. I
And
think
that you said it was quarterly
somebody did.
because of everything that you have to do and as busy as you are and with the work that's going on, you didn't need to sign your plate every month.
Right.
So
So
I,
if I would then suggest like the end of September would be my next report. In October would be my next report through the end of September.
And that lines up with quarterly
Yeah.
in January. All right. So we need a motion to allow Mr. McDonald to do quarterly reports, or
I'll make the motion.
do I have a second?
Okay.
All in favor?
Right.
Aye. Opposed? Carried.
Thank you.
Yeah. Kevin, thank you for everything you do.
Thank you, sir. You're welcome.
You've got it's a heck of a program, I'll tell you.
Like I said, I just wanted to also report, I know we would talk about we finally got, our second transportation vehicle. Our other one had been struck by another driver and has been off the road for about 9 months. And finally we just got it Friday. We put it on the road today. The driver calls us at noontime that the emergency buzzer on the back door will not go off and people can't. So we had to drop everybody off at ShopRite for a cooling center and get vehicles out there to take these people back home. And Ken and I called the company up in Penn Yan, New York, put us on with a technician, told us what to do, and we fixed it. So we're mechanics also.
Pair of wire strippers. There you go. All right.
Hey, Kevin, highway's
Third
hiring.
time I got it.
Yeah, I heard that. I was gonna suggest Ken. Ken actually did the, Ken's one that actually did
Thank
the.
you very much,
Thank you very
folks.
much.
Thank you, and
Bye-bye now.
thanks for your
Nice to
patience.
see you all
Thank you.
again.
Thanks.
Everybody's falling down, so
Director Almasi,
leave it open.
thank you for your patience after that lively discussion.
No problem, enjoyed it. Nice to see everybody, good afternoon. This is my first time with you in person in a while, I wasn't here last month, so this is nice. What you're looking at is our overtime report, and basically, we've only spent a fraction of what we've budgeted, $2,892.07 is what I had to believe is what that says, so that leaves us with an ending balance of $9,107.93. So we're well under budget there. In terms of the resolution that you're looking at, I believe they're all general resolutions this month. This is involving a nurse practitioner that has since resigned, but has stayed on with us 1 day a week. And that previous resolution is on the verge of expiring, so she has agreed to extend it. I'm very interested in having her extended because of the need that we have with regard to our prescribers at the moment. Just a side note on that, there is something known as the reason we lost this nurse practitioner was no fault of our own or hers. What happened is there's something known as the health professional shortage area. And Greene County is the county that she went to because all of her student loans were forgiven as a result of Greene County being categorized as one of these designated areas. I've looked into why Columbia County is not entitled to an equal level of consideration. Unfortunately, the data by which they make these determinations is skewed. One, because of us having the hospital, it inflates the number of behavioral health professionals that we supposedly have at our disposal. And in addition to that, the list that was shared with my office was inaccurate. There were many behavioral health professionals on there in terms of Columbia County that shouldn't have been on there, meaning they've retired, they've left the area, or they're deceased. So we've tried to work with the folks at this, I believe it's a federal designation, to get their numbers realigned or recalibrated so that Columbia County could be considered for this designation, because to have lost a nurse practitioner for this reason was very unfortunate. So I just sharing that with you to put it in context.
Is there any idea of when they would update the numbers on that?
No, I have my county contract planner manager checking in with them pretty much monthly, or bi-monthly. I don't want her to be a nudge, but she makes the call or sends an email to say, hey, when are you folks
Gotta be a nudge.
intending to, right, this week,
Gotta be a nudge.
that's right. But to just ask, when are you intending to revisit this so that we as a county can be given the opportunity to present you with accurate information as far as a list and be fairly reconsider, because right now it's an unfair, it's skewed. So, but that's why this particular nurse practitioner, who could blame her? I think her student loans were nearing $100,000, which just go away as a result of her participation, or excuse me, Greene's ability to participate in this program.
That's amazing.
So she stayed on with us 1 day a week. That's a help. Everything's a little bit of a help. So I'm asking for your support to extend that for a period of time. I believe it was, what is it, another 6 months?
So February.
Yeah.
Maybe you'll have an answer by then too.
Yeah, I'll move it.
I would like to think so, but I hope so.
Further discussion? All in favor?
Aye.
Opposed? Carried.
So the next resolution is of a similar sort. This is with our lead medical consultant, who's with us 21 hours a week. Currently, we've asked him if he could help us out with an additional day to assist with our prescriber shortage. And he has agreed to do so. Now, I may not need to tap into this only because I'm working on an alternate solution. This alternate solution involves a resolution that all of you had previously approved. It allows us to contract with an entity known as a Novotel. They're a remote behavioral health provider, so they provide virtual mental health services through video connections or through telephonic connections. I'm about to ink a contract with a full-time employee of theirs, a candidate of theirs. So if depending on how long it takes to get him on board, I may or may not need to implement this resolution, but I'd like to have it in my back pocket.
Necessary, I'll move that.
Thank you.
Second.
Any further discussion? All in favor? Aye. Opposed? Carried.
And then I think this is the final resolution. It has to do with a local non-for-profit known as Colby County Pathways to Recovery. Some of you may be familiar with them. The county currently gives them some funding to staff a hotline. What's happened most recently is their location where they're set up, the building's been sold. The landlord has communicated to them that the lease has expired, and the landlord has communicated to them that they want to convert the space into residential apartments. So they need to vacate the space. I am wanting to use federal salary share dollars, which will not encumber any expense to the county, to bridge the gap between the rent that they're currently paying and what the market is currently demanding. There's a difference there. Lori Antonson has told me that they found a space since I drafted this resolution that would require an additional $1,600 on top of what their current rent is. It's $1,500. So the $1,500 and the $1,600 brings us up to $3,100 monthly rent for the space. I would like to subsidize that for a period of 18 months just to help them. And their solution going beyond the 18 months is that they're going to have a board member who is retiring his full-time job and will be able to dedicate more time and energies towards assisting them in finding grants to help their overall sustainability. And she feels confident that they'll be able to secure grants within the 18-month period that will help them cover the additional expense as far as rental costs goes.
I'll move it. So it's $200 more a month? Is that what it is, or?
No, it's $1,600 more a month. The current rent is $1,500 that they're paying.
Yeah.
They landed a place, I don't think they paid the lease, but it's $3,100. So it's a $1,600 difference. This resolution would need to be tweaked. And I think Joe spoke to Kelly about that because it reads, 1,800 up to 2,000. So given that we're only subsidizing 1,600, the language would have to be amended, but I was told that could be done here. Is that correct?
And we currently do that, we currently subsidize them now?
Not subsidized, we provide them $10,000 to staff a hotline.
Gotcha, okay,
Yeah.
I understand it now,
Yep.
I understand it.
Okay, so do we just, as a matter of form, need to make a motion to amend the resolution?
Well, you can make the motion to accept the resolution with the amended amount. And then, Joe can send me over a revised resolution, how you need it to read.
Okay.
I'll make that motion.
Well, Claire made a motion.
Oh, Claire, huh?
Claire, you made the motion.
Oh, Claire, you made the
Yeah.
motion, I'm sorry, that's right, you
You're
did.
full of sugar.
I'm not anymore, I swear not, and I will second that.
Okay.
Further discussion? Thank you so much, Director Almasi, for doing that.
Well, you're very welcome. It was my pleasure.
Abdu, all in favor?
Aye.
Aye.
I do,
Opposed? Carried.
I do have my bi-monthly director's report. I know.
You have another resolution.
We have Dr. Khan.
Oh, I'm so
No,
sorry.
Valley. Carlos Valleys.
Valley was the previous one, right?
Oh, sorry, I was going to my own,
Khan
List
was
here.
the second one.
okay. So let me speak about Dr. Khan because I spoke about Dr.
Okay, so
Valley.
that was Valley for,
Yeah, we got it
okay.
over there.
All right. So with regard to Dr. Khan, she is a psychiatrist that we were able to identify through some advertising, who's joined us for, I believe it's 20 hours. But again, because of the situation that we had, which if you don't know, we had a county employee nurse practitioner simply walk off the job. That created this prescriber need. So I approached Dr. Khan. I said, are there any additional hours that you can give us? And she graciously offered to give us an additional 2 days. So total of 14 hours. In terms of that nurse practitioner walking off the job, I can assure you that, again, it was nothing that occurred on the department's end or the county's end. Without going into too much detail, I can say that I was just attempting to discuss her time in attendance, which she didn't respond favorably to. And then to my surprise, initially dropped a 30-day notice, then accelerated that to a 10-day notice. And then I met with her to simply discuss her caseload and how we were going to plan for that. And that was at 10:30 in the morning, and 11 o'clock, she walked out the door and never returned. So we've been scrambling. And these, many of these resolutions are as a result of that.
Great resignation.
Is that something that you?
No, I'll try to
report things like that to professional misconduct?
Great question. I've left 3 voicemails for the Office of Professions because I need their feedback to determine whether or not that's considered professional abandonment.
Abandonment,
Now, in my opinion, it is, but the Office of Professions may see it differently because we do have prescribers. It's not like she completely abandoned them with no resources, no backup prescribers, etc. Has it created a tremendous hardship for me, my staff, my
Yes.
department, the clients?
If you're talking about an individual, you really should be in executive session.
Okay, so,
Thank you, Ken.
If you want to continue,
no
we need to go into
continue.
executive.
Thank you for the reminder of that.
Yeah.
So Dr. Khan, has agreed and has been with us, so.
Okay, do I have a motion? Do I have a second?
Second.
Further discussion?
Who made the motion? Sorry.
Yeah.
Sorry, I can't see hands.
Second.
All right.
All in favor?
yeah.
Aye. Opposed? Carried.
Okay, and I think that should be it. So in terms of the director's report,
requesting to create and fill one social services fiscal technician. This is a grade 14C, base salary 54,000, and any backfills created therefrom. This is sort of a part two to last summer's restructuring of the business office. You'll recall we abolished a couple of positions. We came in wanting to hire a director. We were going to abolish the accounting position after the director position was filled because it was filled by our accountant. And so the final part of this plan was to create the fiscal tech. And so I waited until I had all the other pieces in place. So it's fully budgeted. It was last year. It's just now sort of pro forma to create and advertise for it.
Okay, do I have a motion?
I'm open.
Do I have a second? Any further discussion? All in favor? Aye. Opposed? Carried.
Thank you. And so there's some contracts that we use to get services for our clients. So I'll list those off, and if anybody has any questions, certainly happy to answer them. But question number 4 is to enter into an agreement with Dr. Steven Silverman for the provision of mental health services. That is for youth.
All right, do I have a motion? Do I have a second? I'll second it. Discussion? I'll ask one question. I don't want to bring up the sore spot or betray my ignorance. Why aren't you working with our mental health services?
We do. So we just try to have as broad a choice as possible because can't always work with our local department.
Plus, he has 10 vacant positions right now.
There's that, there's lists, there's lots of reasons. We certainly do.
Is this for a psychologist?
It's really for mental health evaluations.
So we do have a contract with the Department of Social Services. Our psychologist is contracted to perform what is likely similar evaluations.
Okay.
They're just
These are all
Having options.
they're all per diem, yeah. Making sure somebody's on contract to do it if we need to. Sometimes our children are placed out of county.
Right.
We need to have these evaluations done. So
I was gonna say it's kids in placement mostly.
yeah.
All right, terrific. All in favor? Aye. Opposed? Carried.
All right, this is very similar. A request authorization to enter into agreement with James Lytle, nurse practitioner for the provision of mental health services and medication management. Very much the same.
That's not what
That's not what's on screen.
that's not what-
Yeah,
Yeah.
we've got
Oh, has that changed?
respite services.
I mean, hold on. I mean, maybe it's out of order.
Looks quite possible. I have that as
It's
my
missing.
number 5.
It's missing from the scan. Yeah, that one's missing.
So the James Lytle just never made that particular.
It's in your agenda and it's there. It's just not in the scan.
Oh,
It
okay.
got-
Interesting
you
enough, I have it. Yeah. I'll pass this around. It ended up in my packet if everyone wants to look at it.
Okay.
It's on the website, the supervisor's website.
I'll move it when it's ready. Yeah, like that.
You can just read it. It's,
Yeah, you can throw it back to me, just.
Dr. Wydell is in Catskill.
I don't know where Dr.
Okay, whereas the Columbia County Department of Social Services Child and Family Services has the need for additional mental health resources for identified children and families. Mr. Wydell is able to provide such services to these families. I have a motion. Do I have a second? Second. Discussion? All in favor? Aye. Opposed? Carried. Jim was on this one. We're going with the non-highlighted version.
Yeah, no, that's fine. That's great.
Okay.
Wydell is in Accra. Yeah, okay.
I've attempted to work them and I don't get responses, and I'm wondering if maybe that's something the county can talk about with Dr. Wendell, since we are in contact with him. Not just myself, people from the school have reached out to him.
Well, no, I would like to know more about it if we're going to enter into it. I mean, do we want to go back to discussion? Because I don't know the individual. There's something we should know. I'd like to,
I don't know.
I don't know.
I don't know.
I'd like to know.
I opposed it, so if we wanna have a further discussion,
Okay.
that's fine, I don't mind, but
Do you wanna just hold this resolution till next month?
I would hold it, yeah, I would hold it.
I agree with that.
I'm just gonna make note and I'll bring it back, but I cannot speak to this individual, I don't.
It's James Waddell and
James J. I pronounce
Nurse
it.
practitioner, right?
He's an MP.
his his own process.
actual.
Okay.
Somebody wants to say that.
All right. Now, so what would you like to do? Make a motion to rescind the resolution?
So basically, you're just holding it to next month for further.
Can I hold it after it's now gone through? Because if I can do that, I'd just as happily pull it and bring it back after.
Do you want it to go through this committee now and then,
No,
no, so you want to
pull it back.
defer it, okay.
Yeah, because I'd like
Pull the
to
resolution.
bring some folks in on a discussion.
So after further discussion, you need a motion to pull this resolution.
Okay.
We've already voted on it, so.
Okay, Supervisor, thank you for bringing that to our attention.
Yes, thank you.
Okay, so would you like to make the motion?
Sure,
Paul?
I'll make a motion, okay.
All right, do I have a second? I'll
I
do.
do
Thank you.
second.
All in favor? Aye. Opposed?
So we'll hold that one,
Thank you.
okay.
Okay, number 6, request to enter into an agreement with St. Catherine's Center for Children for the provision of respite services.
I'll move it.
Do I have a second?
I'll second.
Further discussion? All in favor? Aye. Opposed? Carried.
And request to enter into an agreement with Parsons Children and Family Parsons Children and Family Center. They're an affiliate of Northern Rivers Family Services for the provision of therapeutic foster home respite services.
Do I have a motion?
I'll second.
Further discussion? All in favor? Aye. Opposed? Carried.
So if it would be all right, Chairman, I would like to update the committee on a couple of things. Very briefly, and I've got some handouts if it's going to help. And also for anyone in the audience. But I brought this up as we were breaking up last time. We gave it a few minutes, and I'd just like to do it again. You may please.
Bob, do you want to hand over the chairman?
Yeah.
No, you can have those, I've seen it.
Okay. See that? Okay, very good.
I have to
See your. Okay, Steve's moving in and moving around.
This has been updated so that there's no personal information of any client on the list. Just wanted to demonstrate the number of folks that are ready to move forward with permanent housing. And I focused in on, for the most part, folks that hold vouchers through housing and urban development. They're all set to go. We have very active home finders. We're not able to find permanent housing within the range of these vouchers. There's also folks that are not voucher folks. They're on here, and they simply, there's nothing in their target range for income. I think I might have run like I did last year, or last month.
Could you just explain a little bit more on what you mean about the vouchers?
I can, because that's part of what we're going to discuss today. But I was thinking that I had printed out and I did not. today's search for housing and what comes up in Columbia County when you search for it. It's not even close to being able to fit with these folks. But so, and so what I wanted to have a further discussion, because Supervisors Cousins and Adams have been into my office to talk about this. And here's essentially a quick version. When you apply for, when you get on the list, housing and urban development, to qualify for assistance, paying rent, you go through a pretty rigorous application process. It takes you a while to get on the list, okay? And then you get on the list and you have to wait for that list to factor through, and then your name comes up, okay? And then, you know, chances are everything's going to go through and you're actually going to be provided with that voucher. And as part of that process, you're given 45 days to go out and find suitable housing with that voucher. And what can happen is if you're not able to do that, or if something has prevented you from doing that, they will extend it out another 45 days for you to do that, so you get to 90 days. And then if you're still having trouble with the assistance of your local department, you can apply for a third or a second extension, a third 45 days, saying, here are reasons, here are causes why this person shouldn't lose their voucher. Okay, here's the theory behind that. You could have a list this long. And the theory was, when by the time we process through this list, we really want you to take action and take that voucher and go find permanent housing just as quickly as you can, so that we can then get to the other folks on this list, right? Well, what happens when you start to get to the point where we're at? We have people on the list. They're ready to go. There's over 20 on here right now. Not all voucher folks, but many of them voucher folks. And they have a certain income range, or there's a certain income eligibility, and they can't find anything. My home finders can't find them anything. My homeless caseworkers can't find them anything. And the daily searches on the internet don't turn anything up. And our relationships with our landlords don't turn anything up. And the property managers around town don't turn anything up. And 45 days goes by. You got to ask for another extension. And so you do, so on and so forth. But here's the thing. You get to that last extension, what's theoretically supposed to happen? Well, they go back down to the bottom. And then the person next on the list gets their chance out in the field. And clearly that's not going to go well, because it hasn't gone well for the person before them.
Yes.
And there's still nothing available.
And there's still nothing available. Meanwhile,
They're living in temporary housing meanwhile.
Yeah, and now have lost any chance if by some miracle housing does become available. It's not going to happen. They have to go all the way back through the list to make that happen.
And we shouldn't even call it temporary housing, because most of them are in the motels and it's just not sustainable or
It's emergency.
favorable housing. It's emergency housing, so it's not even temporary housing.
It's emergency.
Commissioner Gibson, can you put it in context for the audience in terms of these vouchers and what the dollar amount is that
Yeah.
comes with that? Because that's gonna drive the point home in a way that, and if you don't have that information, I can speak to it anecdotally. But basically, the amount not only has to cover the rent, but it has to cover all the utilities, if I'm correct. So it makes it just that much harder. And I think for a single individual, do you have it there? I don't want to misspeak.
Well, I have it broken out by efficiency, 1 bedroom, 2 bedroom,
Right,
3
right,
bedroom,
okay.
4 bedroom. So I certainly have that. But to your point,
You're looking at paper with that. I can tell you that's not happening. Yeah. That's your point.
But even, so the vouchers are Section 8 vouchers, so they're only supposed to help with a portion of somebody's rent. So say you get a $900 voucher, that's supposed to put a big dent in the bill that you as an individual have to pay every month. If you are in a $2,200 apartment because you need 3 bedrooms for your children, you're still paying above regular rent of what people are used to and when those numbers were set. So people are remaining homeless because they simply can't afford with or without the vouchers. And then people at the bottom of the list are losing their vouchers because they're not able to find housing. And then what they do find is not safe and adequate. So the process just keeps turning, and there's out of touchness between what the state and the feds are saying is acceptable and what's actually available. Yeah. So the crisis is like deeper than even being affordable. It's like landlords are also taking advantage of the fact that we're off of this moratorium and that they can continue to raise the rent at the moment. They can kick people out so that they can do that. And our housing market is just going down a lot faster than I think people anticipated. So these folks are sitting in motels. These are not even, I don't even think these count folks that are staying on family members' couches, but it affects the homeless numbers in our county because we don't have affordable housing available. And not just subsidized housing or Section 8 housing. We don't have affordable housing, period.
That's exactly right. So this is the other end of the problem that people don't see a lot, which is, you know, and it's good. We work with folks that become homeless, and we drill down, and we certainly want to provide the services and then connect them up with the resources necessary. But, you know, it's important now for it to be known out there. And what did we say, 5 housing studies in 10 years? So we know all about the problem. We know how, and the only thing that changed in those housing studies is the housing stock continues to drop.
Right.
So it's not like it provided an impetus for any solution in the community. So this is a real problem. And that's right. These vouchers are supposed to make it so you're getting this 3-bedroom, but it's affordable out of your wage that you're making, because this is making up the other part. Because these are working folks, you know. I think that's the misnomer, is that, you know, it's not free housing, and it's not people who want, they're working at what we have to work at. Correct. It subsidizes rent that's sort of getting out of their range. And if you're going to work at these jobs around here, and even stewards and the big lots, remember these in the hospital, but they're having an awful hard time recruiting. Well, I wonder how much of that is housing. You know, I mean, it's becoming more and more. I know it is for us. I know in our recruiting process, you know, $50,000 doesn't go where it needs to go. And you don't want to have to drive here from that county. So,
and the wages are slowly climbing, and it's not, these stipulations aren't changing. So like $16 an hour to the department is a lot of money, when we know that $16 an hour is like, you're going to take that job. You should wait till you find something that can pay you more, but people have to take those kind of jobs or have no job at all to receive any type of assistance.
No, and Brenda's presentation with the patterns for progress and the tabulated data were daunting, to be sure.
Yeah.
The baseline that we all accept is that you should not be paying more than 1/3 of what you earn for housing. So that makes it even more difficult. If you're paying more than 1/3, then you can't put food on the table. You can't buy oil. You can't drive a car. You can't do all
It's
this.
winter,
Right.
oil prices.
so all of this was, you know, we've sort of got a group that's working, and we're working with the city's housing coordinator and with the city itself. So we're trying to get some coordinated effort back at, you know, incentivizing developers to come in and build some of this affordable housing. Some is on the way. I do know that. The mayor has informed us that you know, there'll certainly be some projects on the way, and that's a good thing. You know, there could be more. There could be more in the works. So we'd like to certainly do whatever we could to encourage that. And we're thinking maybe the board needs to put a letter together to our Congress representative, and our senators, geared towards HUD, so that we can advise HUD, and I'm sure regions all around the country are doing this. This is what's going on. So on top of all of this, it does you no good to penalize somebody who can't find housing in their range. If there's not housing in their range, you're actually you're creating more of a problem. So that was sort of the thought, is that there should be some board action taken. I'd be happy to be involved with that. A letter, perhaps from the chairman and the supervisors
Yeah.
to our representative and to our senators.
But there are 2 points, right? One is the unintended consequence of the sunset
Correct.
of the extension. And the other is that the thresholds, the dollar thresholds need to be reevaluated.
It's high time for that. If these are fair market values for these rents, then that needs to be taken into consideration.
Yeah.
Not 3-bedroom apartments in 2007, but in 2022. Otherwise, you're asking them to come up with $1,200 a month out of their pocket, which they cannot do.
Yep.
So you think Mitch McConnell's gonna hear you?
I don't have a comment on that. I hope somebody.
My job, to bring up this. Yeah.
All right, can you have a letter for this committee to
Well,
endorse?
if that's, because I'd be happy to work on that.
I'd love
Put
to do that.
something together with my colleagues here for this, for the board's signature, the chairman and other
Yeah.
supervisors. I think, certainly, and I'd be happy to sign as commissioner. Maybe some other department heads would as well. But, I think that could go a long way to at least say,
And there's only one housing authority in the county, correct?
correct,
We're lobbying for a second, but
correct. But this should surely come to a head. I know every year it does, but it comes to more and more of a head every year. And it will again. It will again this fall, when people who are perfectly able and willing and want to live independently need our help in emergency housing. And then it gets cold. So, towards our greater project here, where we're trying to get more sheltering resources. Yeah.
Would there be any value in strength in numbers kind of theory here? Or would we dilute our message and our cause if we try to partner with surrounding counties? Because everybody is experiencing what we just described. This is affecting, all of New York State in similar ways. So if we, our voice might be heard in a more profound way if we partnered with, a neighboring county like Green County and said, hey, would you be willing to send a similar letter?
Like in the open room.
Yes, exactly. But I don't want to stop our momentum. If that would bog us down, then we could pursue that. But it sounds like we have good momentum in the room and this could be done relatively quickly.
Well, I think that's a good point, because I don't want to slow momentum down, but it could be one of those things where this board reaches out to the legislature of Greens to let them know, this is what we've got going on, this is how, we're going to put a letter together. We're essentially going to draft it and we've got some data that we can provide inside the letter. And I know my colleague in Green goes through this. I know
You could almost do a resolution.
Or
A resolution from the board, and then a lot of times the other,
Send it with a letter.
right, the county, the clerk's board shares their resolutions with other counties and said, hey, we passed this resolution. This could be something your legislature or your board of supervisors could consider passing as well. That's another, I see that a
That's
lot.
The
good.
same resolution is shared by
Correct.
neighboring counties.
Right, and then they just adopt it in their own form.
Right.
And pass it through their,
Because I think to knock on, the state and the federal government's door with a united
multiple.
sort of.
If we start the ball, here's the first letter, and then you reach out to Green County, get the second letter. By the time they get the third letter, they wait, and maybe we need to pay attention to this.
It's generally a resolution urging Congress or urging, whoever, state legislatures or, whatever, to act on this immediate need or whatever.
Because this fall it's only gonna get worse.
Yeah.
One of the reasons this came to my attention is because I noticed that the number of people that were in emergency housing were not going down in the
Right.
summer.
Right.
And normally
Right.
they do almost by 50%, but they are not this year. And so that,
Because there's nothing about.
right, and
Yeah.
if we think about the crunch associated with not only housing, but gas and food, we may have an even bigger problem.
Housing stock is not going up.
Right.
I don't know what the city's stance on short-term rentals is.
Well,
But I think that probably
they've
has to be
certainly
back.
taken a look at it. They're involved and I appreciate that in the discussion. Again, I think this is a four-headed monster and one of it is development. And it seems to me there's incentives out there, programs out there, to attract developers and there's clearly a need for it. So I'd like to see, I know there was a call a couple of months ago, I'd just like to see action like that build back up. But we thought, some concerted effort on those two points, at least at this point in time, and great idea to then, get the counties to sort of come along on that. It just seems to me that money went in every which way in every direction. Okay, when COVID came around, and it still didn't go towards permanent housing. And I asked that it go
Yeah.
towards permanent
Yeah.
housing,
Yes.
and it didn't, so I like all of the other things that it went for, but for my way of safety net money needs to start being used to get people out into more
Right.
permanents, because I think we can find the employment. I think that it's a step off, but to ask people to step off before there's housing is just not realistic. It keeps them, these folks want to go out on their own.
Yeah, and she spoke to the housing conditions. You can't be settled and be, let's say, if we wanted to look at it as more of a callous look at, you can't be a productive worker if your home life sucks. So, this is definitely something we have to work on, so.
Yeah, so, it's probably a very opportune time to do that. So I'll work with the supervisors on resolution language, and then we'll match a letter to that, okay?
So Bob, why don't you go for the governor? Why do you leave the governor?
Well, we probably should not
Well,
do that. We were focused on housing and.
I think the governor is, it's not a bad idea.
It's a good time to reach out to her.
He's looking to be reelected.
Good point, sentiment, yeah. No, I think that's something we should do, get everybody involved. Yeah. I'll leave it at that, it'll certainly do that.
Definitely, if you could have something for this committee, it sounds like we're all unanimous.
Yeah, a little bit, it's on here.
Yeah, one more, quick talking point
Yep.
if we could. And
Great.
it involves the domestic violence shelter here, in Columbia and in Greene County, although there is none operating in Greene now. I think we went over that. And so Supervisors Cousin and Adams, myself, I think that was the extent of ours. Supervisor. We reached out to the director, of Community Action Greene County and one of its board members to talk about the concerns brought up at this committee the last couple of months, which is to say that not only did one of the shelters in the area close, but the other one had its status change from a full-on to, is it safe dwelling model. So you're essentially looking at daytime coverage from professional staff, but any intake at night is happening on call, and there's nobody right there, no professional services, on the ground. And what we learned in our call, and it's staff related, inability to attract that staff.
Yep.
is that they're looking at this more as a long-term. So,
This reduced status.
yes, having not been able to hire for 9 months, they're now decided that this is what it's like now, and so that status shift may well be permanent.
So they're gonna budget for that reduction and
Well, they would, again, this is not being able to find staff. The money, so in other words, the money flows through both local departments. So when somebody does an intake and they're there, the money's going to be there. That's not the problem. They don't have the folks to staff it. It's much like the warming center that we tried last year. Money is there. There isn't staff.
And with their intention to not go back to a fully functional shelter, a safe dwelling model doesn't meet the needs of our county when it comes to domestic violence. And that's not, like, if we're contracted for a domestic violence shelter and all of the full-on services, we have to find a way to supplement that because the numbers rose with COVID, the numbers will rise with the winter. And, you know, with the homeless numbers not going down, that also exacerbates domestic violence. And we need to be able to offer shelter and all of the services that were provided, including court advocacy.
It's counterintuitive to what the basic mission is of the shelter, which is to house the person, but you also give them the wraparound services to then be well enough to one day leave the
And in
shelter.
the emergency, you know, on the call, it sounded as if all of their services remained in place, but from talking to the clerk at the county court, when somebody calls their hotline with an order of protection request, usually they would have sent out a domestic violence worker to be at court with the person, fill out the order of protection, and do the clerk then refers somebody to the woman who is running the library. So it's county employees that are filing petitions for orders of protection, not domestic violence staff. So it's falling back on us. The burden is falling back on us, and we're not getting the contracted services that we should be getting. So.
and you can raise that salary, but no takers on that extra step.
Well, right, Bob, is it?
We don't
interest in
even
the
set
position,
that.
Or is it salary?
She said, we had both the executive director and a member of the board on call to make sure that the board was fully cognizant of these changes. And they said that they had offered an increase for overnight staffing, but in 9 months, not one person applied for the overnight
Well,
shift.
the increase could be relative. What are we talking here?
We didn't talk exact numbers. But
So
this is really
4 years ago, I think overnight was paying $10.80, and recently I think they might have gone up to 12. And I know that their daytime staff position was offering 16, and it used to be 14. So, you know,
Why would you get paid more for the day?
I'd say, why would you get paid more if
because
you do
it's
it
a
the other
sleep
way around?
shift. It's a sleep shift, so you can.
Okay.
Okay.
But still, $10 an hour is,
Those wages are not competitive to attract any candidate.
No, I just.
But they're raised, so you know they would argue that they've done. They've tried to put a dent in that, but $14 an hour. I mean, $16 an hour to do case management, advocacy, shopping for the shelter, shopping for the individuals, helping them, you know, organize appointments, getting them to social services, apartment searches to get them out of the shelter. $16 an hour is nowhere near good.
Looking for a house that doesn't exist.
Correct. And the frustration that comes with that.
And they also had transitional apartments on the property that was a part of their domestic violence services. So there was 4 apartments that people in shelter could look forward to after a successful stay in the shelter, moving into if they were eligible, and you know, without being a fully functioning shelter. That also is just 4 options off the table for housing.
So I think the reason that we really wanted to talk about this is because we wanted to make sure that, again, the board and the staff were in sync, and they really seem to have accepted, as Bob said, that this is the reality, and they don't seem to be interested in making any additional effort to improve, to deliver what they promised, to improve the situation, or to think about the future. What does this mean? So the question I asked Bob is, are there any
any other services available to Columbia County? Do we have someone else, another organization that we can look to? And I think the answer to that is no, right? There isn't any other service provider.
The only suggestion I could think of is, and we talked about this a little bit, is bringing in somebody as a contractor. But again, it's like if there was a shelter and then there was a contractor that could provide services within the shelter, you would be addressing homelessness and you would be able to provide the wraparound domestic violence services. But we don't have either one of those at the moment. Like they're all organizations that would provide this service are swamped because of the housing crisis and because of the rising domestic violence numbers. So who would come down and add to their workload at this moment?
But I misunderstood. I thought, that when we had talked earlier, it sounded like these people were, these positions were being well compensated to try to bring in, but these wages that were just mentioned are deplorable.
Yeah, well, that's right. That's exactly the opposite tact we took when we tried to staff an overnight warming center. We drove
Right.
the wage through the roof. And I suppose we got no bites on that. This is overnight at a warming center, but it was a real wage, not $16 an hour. So
And still couldn't get
you're
it.
not gonna get that at $16 an hour. We couldn't get it pushing 40.
But the other thing, to Claire's point, is so the green beds are gone, and there's 0 beds in Green County,
Which was
10 beds.
10 beds over there.
And then we had
15.
25 and we're down to 18. We lost a third.
15, I think.
It was 15 beds, so it went down a lot.
Right, so we're down by a large number of beds. So when we ask how many, when are we turning people away? They're not. They're just they're relocating them in other places.
Which are also full, so,
Right.
to know where they're, and the thing that exasperated this issue to the county was that a mother reached out to the mayor because she was in shelter and she needed to be relocated, and they referred her to the county to be put up as a homeless individual. So if they're not continuing service with domestic violence, they're not always being placed in another domestic violence safe situation. They're getting referred to the departments as homeless, and we see the list of what homelessness looks like and where people are even available to go. So it's just adding on to our problem.
With no real plan
No.
to safely, you remember that security is a big part of this.
Right.
Okay, there's anonymity, there's
Compromise.
correct. There's no way, and they don't feel like they have that. And, that's just not a solution. To say, well, it's not working out here, so we're gonna bring you down to the local department and they'll put you up as homeless. Now, I forget, on the phone, they sort of gave some talking points that, well, we do try to find another shelter. And from my way of thinking, you must find another shelter.
The pandemic that you talked about, they don't really address money for housing, but domestic violence numbers went up. Is there no rollout of state money to help in any way? Because it's definitely a byproduct. Well, it was exacerbated by the pandemic. Domestic violence.
I'm gonna ask about that because it seems to me it's a flow through, right? Using our office. I don't know why they're limiting their.
It sounded like in response to COVID that the state was more supportive of whatever changes each organization felt they need to make. And instead of ours asking for more money, they asked to switch to a safe dwelling model. And the state was supportive of that and is allowing them to remain safe dwelling instead of a full-blown shelter.
And I agree with that. My assessment was that they just wanted to make sure that there was some service provided and they weren't as keen about what.
Just to scrape by, just to make sure they had some offering.
But we asked the question twice, were we meeting our obligation to the community? And our answer is no, their answer was yes.
Right.
So there's the disconnect. They think they are.
We need more services than we're providing.
And they are a Greene County agency with no domestic violence services in Greene County, only a safe dwelling shelter in Columbia County. So how they feel they're meeting a need and serving the community is beyond me.
It's a watered down product as compared to what it once was, so it's not the same.
Right.
could make that argument.
Right.
And I'm concerned about what you just touched on, which is, let's not forget, we're talking about domestic violence.
Right.
There are individuals on the other end that are trying to get to those individuals quite often.
Yeah.
Housing them in emergency housing in a motel, it's no secret where that,
At all.
individual may be.
It's not secure.
And the one that we place people in the most, which is in Canaan, everybody knows how to get there. And if a victim was out there and an emergency did happen,
Right.
how do they escape if they don't have their own transportation?
But even, you said that the model that they're adopting will not have staff at night, correct?
Correct.
So,
It hasn't had staff applied for months. And we found out, they didn't tell us that, I think we found out, you found out.
And that's what made it more difficult, is that we had to dig and research and ask and hold a meeting before they notified us when we're in contract with them of this change. They didn't take the initiative to let us know that there was, also, his numbers went down for referrals from domestic violence victims that came into shelter. There used to be a stipulation where everybody who comes into shelter has to fill out an application because we are paying for their stay. The state changed some clause in the regulations where it's up to the survivor if they want to apply, but it's also not being encouraged by community action to bring them down to apply for all of the services, because being in shelter, being a domestic violence survivor, and being technically homeless, they qualify for all of the services that we provide.
But theoretically slipping through the cracks.
Well, I can't speak to this because I'm not at the shelters, but the concern we have from my staff is they're not being encouraged to come in and do that because they don't have to. And they don't. And all we need to be told is, we just need to be given a chart like this and say there's 4 clients and X number of nights, and here's the cost. It used to be that those clients would come in and not only get the cost of the shelter, okay, but these various services that would go along with that, including TA, if that's what they wanted to do. And it really sort of,
Which is cash assistance.
Yes, it really sort of, it solidifies, if somebody's going to end up staying here and transitioning out and going somewhere, it's hard to just go at shelter, back out there. You're going to have to use us as a company. So,
Yeah.
It's almost impossible to knit a full cloth, to put assembled package that you need to make someone safe and to move forward.
And that's state regulation, I have to say. So the fact that it's discouraged is discouraging, because they could still say, yeah, but you should go over it. Yes, it would be good for you. The default has been set the other way now.
Right.
Don't have to go if you don't want to, so just let us know. That's real hindrance for the client. It really is.
Can somebody explain to me what the contractual relationship is between the provider of the domestic violence shelter and the county, in a nutshell?
Yeah, we're going to
We have a
provide you
contract.
with the numbers
Okay.
of people staying in our shelter and the dates that upon which they're staying.
Right.
And then we get this per diem based on state
Okay,
state funding.
that's what I figured.
program.
So would you characterize them as being out of compliance with that contract?
No, because they let us know.
Well, don't you think from the point they let us know, but there were several months before they let us know.
No, I mean, let us know the number of clients
Yeah.
being served. That, when it comes to the billing, so it's May, and we serve.
So they reported on the numbers.
Yeah, we served 6.
They're not required, they weren't required to let you know that they didn't have staff.
That's the part that I'm getting at.
You know what I mean?
Well, that was, they were, the shift, so they shift
The level
over.
of service drop in general, that's not breach of contract in terms of,
No, because the state allowed that.
that's, okay.
They skipped us the
The
one straight
state
state.
sanctioned that as, yes, we will shift your status.
So regardless of our agreement or the implied agreement that you're gonna provide a certain level of care to them.
Say, if the status changes, isn't the level of service changing, and therefore shouldn't the amount that they get paid change as well?
Well,
That'd be mine.
Can I make a suggestion? I'm listening,
Yeah.
enjoying this. No, I'm not telling people to leave, but because we have staff online, we have staff here. Can we continue this conversation? Close the meeting, let the people go home that want to go home. Is that good?
Yeah, it's fun. I mean, you've got Cameron on here too, so.
Yeah.
Yeah.
But before we
So
end the
making a
meeting,
motion to
are
adjourn.
you upset with me for suggesting that?
No, I'm not at all.
I mean, this is a
But I may have
conversation
taken
that
on
needs
more
to
than
be
I
a separate meeting
Yeah.
and, you know.
And
I
we
feel
are-
like the full board should know what's happening.
Yeah, and is there recommendations that we can make in a formal presentation of what the county can do to address this?
I think we're at a
What money
loss
the
when it
county
comes to
has?
that.
Yeah.
I think we're at a loss when it comes to that. I think we don't know what our
Right.
options are.
And a lot of it is because we don't have any other emergency services besides motels.
Yeah.
So it ties directly into the affordable housing crisis.
The whole thing, yeah, all one big,
It's all.
yeah, it's a trickle down effect of everything that's
I've got
happened.
to head out, but I just want to ask this, and this doesn't have to be answered now, but are there any models, again, that we could look to in neighboring counties? Where they have been able to be successful in, let's say, developing subsidized housing of some sort, low income housing in a way that, you know, we could maybe take a look at. I don't know.
Did you get a chance to talk to Family Woodstock yet? Just because we have a contract with them, they are the Ulster County domestic violence.
Right.
It's just a trend.
We contract for our daycare
Right.
services. Yeah. So we have not broached whether or not we should do DV or even how that would work, where that would work.
Okay, guys.
We're having a
I mean,
discussion
that's what
and
I'm
you're
saying,
welcome
Michael
to.
Bird could be a real resource if he's still the executive director of Family Woodstock.
Okay,
I think he is.
and he will be invited in. When we meet next, perhaps we'll invite you.
Okay. Sure.
All right, I'm gonna make a motion to adjourn. Do I have a second? All in favor?
Hi.
Thank you, everyone, for sticking around. It's been a